validated in numerous of research projects that meet current methodological requirements. Acupuncture involves the stimulation of certain points on the body by a needle or by direct pressure. So the effect at the operating room is to have the no pain or less pain, or also to treat nausea and vomiting in post-operative. So our era is the era of the acupuncture or non-therapeutic approach because medication sometimes give us some side effects, and even if we combine an complementary alternative or integrative medicine, it will be good for our patients. So acupuncture has a good benefits risk ratio with his effect of non-expensive treatment. Uh, Chinese medicine benefits of this approach, so we can use it at our hospitals to decrease the effects of the medications and also decrease the side effects of our medication, even opioid that gives nausea and vomiting. To date, acupuncture has been used effectively to manage perioperative pain and nausea in several surgical specialties in cardiovascular, neurochirurgical, and orthopedics, with some meta-analysis that prove the effectiveness and the proof that it works at the operating room before surgery and after surgery. So this technique is safe and well tolerated by our patients, and we can use it even for the kids and the children. This therapeutic approach or a therapeutic art is based on an energetic vision to the man connected to the universe. It's different from our Western medicine, which is mechanistic. When we have a gallbladder with a stone, we take off. But in Chinese medicine, they take care of the patient with globality, with psychological thinking, with the emotional thinking. So in Western medicine, we need to have this approach to have has a complementary effect. So this energetic vision taught the Taoist vision is here since 5,000 years. So they use it, attested by a manuscript published since 5 years old, 5 years, and it's used in all around some country, Asian country, with the current efficiency. So it was really at the beginning of the 20th century, and more particularly thanks to a diplomat, French diplomat named Soulier de Morin, that it was introduced in Europe. However, the conceptual gap between the two approaches and the linguistic differences and the methodological difficulty to think on the strategy of Western medicine, they did a rejection of Soulier de Morin, and he calqued him as soft medicine, so Quakery medicine. but so that it was a French doctor named Paul Nogier who the first did published a book about auriculotherapy. This auriculotherapy leads to there is a every organ of the body are their projection on the miniature projection on the ears. So he published and he did a chart as inverted fetus. The head is on the lobula, the neck is on helix, and all the body and all organs are at the conch of the ears. So this book was published, and it was Mao Zedong who said in the 1958 he saw this book and he rehabilitated all masters and doctor in Chinese medicine, and he encouraged to do studies like in the Occidental way of the medicine. That was in 1971 that was a journalist named John Reston who was a redactor in New York Times when he followed the President Nixon to his travel to China. Then he did an appendicitis, and he went to the hospital and he told them, "I'm allergic from all drugs." They wanted to do appendectomy, but he told that he was allergic. Then they did anesthesia with acupuncture, and he was open. Her ears are opened, and he felt nothing. He came back to United States, and he wrote an article, which was published about my operation in Peking. That was a very a good impact for the publicity of acupuncture in United States. And in 2008, all doctors, military doctors, was allowed to use named battlefield acupuncture on the ears to the all military, even before going to the hospital on the battlefield, on the ground. That's what she was named the battlefield acupuncture, with safety and with effectiveness. In 2003, the World Health Organization recognized acupuncture for 64 symptoms, and there was an insurance program initiated by Obama who authorized acupuncture and reimburse acupuncture for all more than 65 years old, and the others which has some disability like diabetes and asthma or some problem. And in 2016, United States initiates a program of research and give money about $40 million to help some Chinese hospital to develop acupuncture and do some researches. And from 2014 until 2023, it was an international acupuncture development program made by the World Health Organization. There is several project or study which recognized acupuncture to treat with strong evidence-based medicine to post-operative nausea and vomiting and post-operative pain at the operating room. How works acupuncture? You know the homunculus of Painfield made by Painfield, a neurosurgery surgeon. Canadian neurosurgeon. He found that there is a correlation between all organs on the cortex. The ears works like reflexology, plant reflexology, palm reflexology, and plantar reflexology, and it is considered as a screen to see what happened in all organs. So we can use it by taking a photo of ears, and we can see, like you see on this screen, that there was a young man with 40 years old, 14 years old, who has chronic pain, low pain. When we took a photo, we found a brown spot in the area. It's not evidence here, sorry. A brown in the kidney area, and he did CT scan, and we discovered the kidney cancer, which was operated in time and early. That's it's important to do some picture of ears and to see, to have causal auricular diagnosis for like functional imaging. Acupuncture made with meridians. Meridians start from the head in some meridians, but also from the fingers, from the foot. So we have 12 meridians, primary meridians, that as you see on the mannequin. How do acupuncture works? All studies are of physiologic effect involve acupuncture. They are poorly understood, but local anesthesia on the insertion of acupuncture needle block the effect of acupuncture, suggesting that the effects are related to innervation. But when we put a needle in the skin, there is a blood flow circulation, and it allow the waste to be taken off, but also to circulation for all cells of the body, of the blood, and it give some good reaction. But the effect of the release of some hormone like endorphin with putting a needle by limbic system was proved by some study, but also some secretion of dopamines and steroids to explain how acupuncture works when we have some anxiety or nervous depression. There is another theory of purinergic signaling. Purinergic signaling is the purine is a substance released and who keep the ADN and to have a relationship the cells with nervous system to keep the cells in good health, and it is validated by numerous of studies that signaling, purinergic signaling, have a role to explain acupuncture. Stress is a barrier to immunitary system, and acupuncture is major barrier of immune system capacity versus infection. Allow when we put needle, there is a migration of cells, red cells, white cells, blood cells, and cytokine. Explain the efficiency, the effectiveness of acupuncture in some infections. There is another theory of fascia. Where the fascia is in our body between the muscles. When we put a needle and we turn the sense of the needle, it keeps and gives some depolarization or piezoelectric modification that explain how acupuncture cure the pain. But in our operating room, before getting to the operating room, we do auriculotherapy for our patients, and we take a photo to see, to have a diagnosis of the patient through this traditional Chinese medicine. Then we introduce the patient to the operating room, but before we do electroacupuncture on the needles to have more effectiveness. The effects of putting a needle on a point named yin tong between the eyebrows keep patient calm without anxiety until the entering and through the operating room. But also the effect of acupuncture on the zone, in the zone. When we put needles here in the kidney, when we have kidney surgery, there is abdomen, we put 4 needles on the abdomen, then we put a needle named a point Shenmen for anxiety on the ears, outer of the ears, but also we put a needle in the on the heart, but also on the lung projection, but also on the liver projection to detoxify anesthesian products. The effect is very considerable to reduce anxiety before surgery and to improve the comfort of operated patient by significantly reducing pain post-operative, by significantly reducing the dose of drug anesthesia, but also to decrease the consumption of morphinic and to decrease the side effects as nausea and vomiting by using a point between 3 fingers lower than the wrist. This point, when we put a needle here, it prevents nausea and vomiting from the patients with some studies, proved studies. It allows us to facilitate the wakening after anesthesia and to avoid the passage through intensive care and to get to the patient's room to improve early and late postoperative rehabilitation, to go at home, and to resumption in vital function with cardiovascular, respiratory, and digestive and urinary to reduce the length of hospital of stay and to prevent also chronic and postoperative pain, but also to prevent postoperative depression with secretion of serotonin and dopamine. Let me show you a small study that I did in my clinic about patient operated for kidney surgery by lobotomy. It's very painful. But when I did acupuncture and auriculotherapy for 16 patients, I found that the pain scale was divided by 2, and the adjunction of opioid was divided by 4. So I found a difference, a significant difference. Even the number is not very. It's only 32 patients. So we need to do more patients. I did it also for maxillofacial surgery by doing for kids before surgery. I used to do some tape at the ears before surgery, and asked the mother to mass it. It's the same. There is a needle of 1.3 millimeters 1.3 I put it on the body, on the skin, and on the ears I put it a small one with zero point 0.6 millimeters. There is a needle, a very thin needle, very thin needle and very small, with a ball behind to permit the mothers to mass it until the appointment of the surgery. So I do it 24 hours before surgery. I did it in mission. We had a lot of patients, 100 patients. We did 50 acupuncture and 50 control. And we found that the effect is good because right now we did 275. We are waiting for more patients to have a result statistically accurate. That's the study we put on the forehead, in the tongue, in some points. This kind of tape. Then, in less than 7 years old, and mandible and lower, because there is a surgery on the lip and the palate. So I asked my master in acupuncture about how point, the choice of what point. She advised me to use this kind of local with the air point, and we evaluate the scale of the pain to the for the babies. The flax. The flax is different from the visual analogic scale, adapted to pediatric scale. It is flax with the face, leg activity, cry, and consolability. And we assess the the pain manage the pain and the adjunction of morphinic after surgery, and we are waiting for the result. In conclusion, we can tell that auriculotherapy, acupuncture with our auriculotherapy with the acupuncture on the body is effective, and in postoperative pain that allow us to decrease the consumption of narcotic drugs, but with less side effects. But we need more studies to have more patients with the multicentric studies. But we should know that it's start to be worldwide recognition. But the problem is none with spare hospital use in some countries. But the analgesic results depend of psychosocial context of the patient, but also by the type and the level of expectation of the patient and the therapeutic environment of the practitioner. Thank you for waiting for until the end. Do you have any questions about this technique of complementary medicine? I use it in complementary way, not we can't do without, because in China there is some videos, and I went to China last month. I wanted to get inside the operating room to see, because they try to do acupuncture only, but they use some narcotics and morphinic. So it's impossible to do without our Western medicine. But we use it as a complementary alternative medicine with a comfort, with the less using of narcotics, but also to avoid the side effect of anesthesia and surgery, and to allow patients to go and to be discharged quickly.
I have a question.
Yeah.
So, in your medical practice, is this the standard to use acupuncture as a synergic way with pharmacology? I just want to understand China, your medical practice is normal to do what you do, or it's just you that is doing something very specific. I just wonder if it's a very usual way or not. I don't know if you got my question. Just curious because over here, a lot of skepticism usually about
Yes.
medicine that is not Western. Doing something like you do will be seen. I know it from
Yeah.
experience, particularly, you always get looked down when you do something different from what the mainstream does. I do some different things, but I mean, so I just wonder if in China it's the standard to use acupuncture in the operating room in the theater before getting into surgery, or if just you doing this because of course it's all your
I haven't the chance yet because I asked for to get inside the operating room. They told me,
you sure that you do it before you put it for 24 hours before
yeah,
the mother does it.
I do it in my hospital.
Right.
But when I get last August, I went 1 month to the International Academy of Acupuncture and Moxibustion, and I did some courses at the hospital and at the university. But like as an anesthesiologist, I wanted to know if it's true or no, and I asked this. I wanted to get inside the operating room. They told me, no, we need authorization by the health minister. So, but they promise me next time I will get inside. I will come back because in my practice I'm anesthesiologist since 20 years, and I use all medications, all local regional anesthesia, all I use it with echotomography, but since I use acupuncture to those patients with heavy, even with heavy surgery, but even to elders and to extreme age, more than 80 and less than 1 years old. I use it with. I'm very happy with it, and nurses are very happy because they told me, doctor, I didn't need this tonight, this night, no morphine, no opioid, and it's a good thing. Why no? I try it. I did some study, and I'm going to do more studies with large panel. But there is some recognition of all community, scientist community, because yeah, there is a friend of mine, Tebul. Do you know Tebul? He's a member of European. He told me last year. He told me, you see this Chinese person, doctor. He is the expert of artificial ventilation, and he gave me a paper on treat septic shock with phytotherapy, Chinese phytotherapy, conducted with the statistical way, and very good paper and article to publish it in our journal. That's why we need to wait. You need to go for her and to see how it's effective or no, and to practice it.
But
When
to push it, you need the numbers.
Hmm?
To push it in the clinical practice, especially in countries where there's a lot of skepticism about this, you need the numbers. And numbers means that you need money also to first do the studies that.
But it's not very expensive to do this study. I use it 10
Yeah, but the
10 10
because they're gonna want the insurance, all this kind of
yes,
useless sometimes
I agree with you,
that kills the research. I mean, so you need to
but we need to do something to, because it's better. I feel better. I'm a better doctor since I'm
it's the
acupuncturist.
way to go. We look at this also in Western medicine when we do synergic action with our medication.
Yes, it's complementary only.
It's the same concept.
Like hypnose, like integrative medicine in oncology. When I have some patient, this morning I did a lecture about cancer and acupuncture. Uh, I show on the paper, on the article, there is a recognition of acupuncture and phytotherapy. And I did it for my patient before chemotherapy, before radiotherapy. I use it 48 hours before, and they don't vomit. They are very happy without pain. And I think that it's the time to go and to try and to practice. The problem of acupuncture is acupuncturers do the diploma, but they don't practice every day. They wait for authorization of the head of the, but the head what open-minded and use this type of medicine that is very effective and used 5,000 years by the Chinese people. Why not?
You know, it's the same way.
That's why I'm here.
You use our drug. You use the
But that's why.
in Slovenia, where I come from, part of the physiology curriculum, we can do also acupuncture. And at our university, we have pain department and have dedicated people who did the training in China. Oh, that's nice. And how I you, my colleague, intensivist, she was on the ventilator because of Gilles Barret. And she had huge pain that could not be coped with none of the drugs. We tried the ketamine, non-steroidal, and she asked for acupuncture. So she could and you have a doctor in your hospital, your ICU? Doctors. That come from the anesthesiology department, the pain unit, and they cover all hospitals. Oh, that's nice. We don't have it. Within 2 days, we removed all the opioids, all the old drugs. And then, later they were teasing her that it was like placebo. I don't care. She was without the pain. She was off the opioids. Call it what you want. It worked.
It works. Why not? I use it with the patient. Patients are very happy after surgery. Very happy. Doctor, I'm good. I have no pain. I'm very.
We see also in
Why not?
pediatric department.
In pediatric.
Now moms come because they have delivery under acupuncture, and with the kids in the hospital, they ask for acupuncture for the kids because they don't want paracetamol.
For the case I show you, for the kids, we have this. It's infrarouge. If we don't support needles, we can do it for the kids.
And how does it work? Infrared?
Infrarouge. No needle. Only.
Oh, just by contacting the
contact, yes, until 10 millimeters deep.
So using that piezoelectric principle,
you can use it, and with effective, no painful for the children, for the kids. We can use it.
Does it work?
It
like
works like a needle. Yes, when we have kids, it's painful. And there is another things. These tools I found it in China last month, because for Chinese people at the hospital, when they receive a patient with pain, there is anxiety because the level of the pain is low. So little stimulation give big pain. So they do some point on the to anxiety. There is a point named Yin Tong and Tai Yang. There is some point to when we could put a needle, but we couldn't mass it until to get into the operating room. I put these glasses to patients before surgery, and there is a massage. I will show you of this point in Yin Tong massage, and you hear the bird singing and the flow of the river, and you get sleep. You get relaxed until the appointment of the operating room with the with stress.
It's nice pre-anesthesia.
Donc pre-anesthesia, I use it, and it's you are relaxed. Good. You will sleep. You will sleep. It's very why no? Because acupuncture, there is acupuncture and the acupressure. The same point. We can put a needle and or put in mass it and with the effectiveness. Why not? Why not? You need to do it in post-operative. In some time, we had proctology surgery for fistula, anal fistula. I do acupuncture before. Auriculotherapy works very good, and I do surgery. After surgery, sometimes it don't work. I painful. I go for the other ears and I do auriculotherapy. It works in 100%. So we need to practice and not to be afraid of the check. You need to go away, and that's it. It's a good technique.
First, go in China, study.
No. I went only for 1 month. I wanted to see how it is, but I studied in France 1 year. I went every month.
But there's so
Three.
many academies. It's so complicated. Also, in Italy, there's like 4 or 5 academies.
You can do it.
No, I'm just saying that you need to choose the right academy. Each academy has its pros and cons. I mean, it's
But you can
not
get
so-
courses
Yeah, I know.
and courses and practice. I think it's a good thing, and you will see the behavior, your behavior change, your even culture, general culture will
It's
change.
more holistic way.
The way of life of this culture, ancestral culture, and the patient is better. The management of the pain management is better with this complementary medicine associated with our drugs. We use opioid, we use ketamine, we use everything. We are available. But when we use this kind of medicine, we decrease the doses and decrease the side effects. That's even for the elder patient. 19, we operated 19, 100 years old for hip surgery, for pancreas surgery. When I do acupuncture, it's very well. The discharge is good, and I advise you to try to do this kind of auriculotherapy only. It's very effective. Auriculotherapy. Then for energetic sensation.
Oh, if you want, I can just take a picture.
No, but you come back. We change after.
I don't look good in picture. Look good in picture.